Welcome to part 3 of your ALBOP FAQ. So next is your destruction of unwanted medications. What are my options for disposing of unwanted medications? Many community-based drug take-back programs offer the best option. A small number of medicines may be especially harmful if taken by someone other than the person to whom the medication was prescribed. Many of these medicines have specified disposal instructions on their labeling or patient information leaflet. There is a list of medication recommendations by the FDA for disposal by flushing or more information concerning medication destruction. This is all on the FDA.gov website, and the ALBOP links to that. Are there guidelines in place for proper disposal of unwanted medications? So there are guidelines that were developed to encourage the proper disposal of medications to help reduce harm from accidental exposure or intentional misuse after they are no longer needed. So one is follow any specific disposal instructions on the prescription drug labeling or patient information that accompanies the medicine. Do not flush medicines down the sink or toilet unless FDA safe disposal of medicine states you can. Take advantage of programs that allow public to take unused drugs to a certain location for proper disposal. You can call your local law enforcement agencies about the take back or contact your city or county's government's household trash and recycling services to learn about medicine disposal options and guidelines for their area. So what if there are no medicine take-back programs in my area? If no medicine take-back programs or DA authorized collectors are available in your area, you can use the following steps to dispose of most medicines in your household. Mix medications. Do not crush tablets or capsules with unpalatable substances such as dirt, kitty litter, or used coffee grounds. Place the mixture in a container such as a sealed plastic bag. Throw the container in your household trash. Scratch out all personal information on the prescription label of the empty pill bottles or empty medicine packaging to make it unreadable, and then dispose of that. So medications for the treatment of addiction. Can Suboxone be used for pain management? Yes. If the physician writes a prescription for Suboxone for pain management, prescription may be called into the pharmacy. Suboxone prescriptions for addiction management may not be called in or faxed to the pharmacy unless the prescribing physician has obtained a signed HIPAA release form from the patient. Any further redisclosure of patient's identifying information by the pharmacist is prohibited. Confirmation of a signed HIPAA release form is not required when a patient delivers the prescription to the pharmacist without direct communication from the physician to the pharmacist. What other information should I relay to patients? So it's important that you make sure patients understand the instructions from the physician and that you answer any questions they may have. When counseling patients, be sure to discuss any relevant precautions as listed in the prescribing information, including but not limited to the following. Patients should be cautioned with that a serious overdose may occur if benzos, sedatives, tranquilizers, antidepressants, or alcohol are taken at the same time as Suboxone or Subutex. Patients should be cautioned that Suboxone or Subutex may impair the mental or physical abilities required for the performance of potentially dangerous tasks, such as driving a car, operating machinery. Patients should be cautioned not to drive or operate complex machinery until they know how Suboxone or Subutex affects their ability to function in these circumstances. Patients should consult their physician if other prescription medications are currently being used or are prescribed for future use. Next question is, what is the role of the pharmacist in ensuring safe use of Suboxone and Subutex? Each time a pharmacist fills a prescription, he or she must verify the prescription received from the physicians who are in compliance with the provisions of the Drug Addiction Treatment Act. Data. Remind patients who are picking up induction doses to return as directed to their doctor's office so they can be supervised while taking the medication. Be vigilant in detecting fraudulent prescriptions or simultaneous prescriptions for the same patient from multiple suppliers. So who is qualified to prescribe Suboxone or Subutex? The data limits office-based use of Suboxone and Subutex to physicians who meet special training criteria and can provide appropriate services to be qualified. Physicians must meet one of the following training requirements. Hold a subspecialty board certification in addiction psychiatry from the American Board of Medical Specialties, and in addiction medicine from the American Osteopathic Association, hold an addiction certification from the American Society of Addiction Medicine, have completed no less than 8 hours of authorized training on the treatment of management of opioid-dependent patients. This training may include classroom situations, seminars at professional social meetings, electronic communications, or other media. The American Society of Addiction Medicine, the American Academy of Addiction Psychiatry, the American Medical Association, the American Osteopathic Association, and the American Psychiatric Association are all authorized to provide this training. And they must meet both of the following criteria: have the capacity to provide or to refer patients for necessary services such as physiopsychotherapy, agree to treat no more than 30 patients at one time in their individual group of practice. So how can I be sure a physician is qualified to prescribe these drugs? Physicians who meet the qualification criteria listed that I just mentioned must also notify the Secretary of Health and Human Services of their intent to prescribe Suboxone before doing so. Once all relevant criteria is verified, DEA will issue the physician a unique identification number under the data, and that typically begins with an X, doesn't mention that, but a Center of Substance Abuse Treatment will send a letter informing the physician of the new DEA identification number. The physician will subsequently receive a revised DEA registration certificate. So what if I get a prescription from a doctor who does not have the special DEA identification number? So the special identification number is not required for physicians prescribing Suboxone or Subutex for the treatment of pain. If this is the case, the prescription must indicate for pain. Call a physician for clarification that the physician has made the appropriate notification to the HHS. DEA is developing regulations that will require this number, along with the physician's existing DEA registration number, to be included in all prescriptions issued for the treatment of opioid dependence. Therefore, physicians are being strongly urged to include this number on prescriptions. Most physicians will make arrangements to obtain the identification number before prescribing Suboxone or Subutex, but in rare occasions, a physician may need to write a prescription before the number has been issued. This is allowed under the data provided the physician has notified the Department of Health and Human Services of higher intention to begin treating a patient right away. The notification form includes a checkbox for this situation. So next, are there any special storage, record keeping, or other requirements associated with Suboxone and Subutex? As Schedule III controlled substances, Suboxone and Subutex are subject to certain federal regulations covering areas such as record keeping, inventory, proper dispensing, and disposal. Alright, so next section, your refusal to fill. What grounds are listed in the board rule on refusing to fill or refill a prescription for the ALBOP? So a pharmacist may refuse to fill or refill prescriptions if they believe it would be harmful to the patient, if there's a question as to its validity, and they believe it is not in the patient's best interest. Emergency refills. So can a pharmacist give an emergency refill on a weekend if the patient needs it when there is no refills left on the prescription? In the event a pharmacist receives a request for a prescription refill and the pharmacist is unable to readily obtain refill authorization from the prescriber, the pharmacist may dispense a one-time emergency refill up to 72-hour supply of the prescribed medication, providing that the prescription is not a medicinal agent listed in Schedule II, the medication is essential for the maintenance of life or the continuation of therapy in a chronic condition. Only those drugs designated by a joint rule adopted by the Board of Pharmacy and the Board of Medical Examiners shall be refilled, according to the procedure established in this section. The dispensing pharmacist created a written order containing all the prescription information required by this chapter and Title 20, Chapter 2. The dispensing pharmacy notifies the prescriber of the emergency dispensing within 72 hours after such dispensing, and of course would request that a new prescription is sent. Alright, thank you. I will post the next section, which should be the last next, which will be part 4 at that point.